Maryland. We can be very proud of our beautiful state. Maryland, besides neighboring D.C., Virginia, and the Mid-Atlantic, is home for people of all backgrounds, educations, occupations, and interests. It's also home for many species of wildlife and plant life. But did you know that in Maryland, as in states nationwide, 15 to 25% of the population have allergies to the very plant life we live with so closely? And 5 to 15% have potentially life-threatening asthma and related conditions like sinusitis. Maryland is unique when it comes to the allergy-triggering pollens and allergens that occur during the year. For instance, during the spring, the major pollens are trees, especially oak. The yellow dust that covers our cars comes from oak trees. During the summer, grasses pollinate heavily, in addition to some weeds and molds. And during the fall, the major pollen is from ragweed, as well as mold. Year-round indoor allergies are caused by dust mites, molds, cat and dog allergies. Virtually anything you can vacuum up off the floor as dust. When the allergy season begins, it's important to know when to seek help from your family healthcare provider or allergist. While in some cases you can treat your stuffy running nose and itchy eyes with over-the-counter medications, sometimes allergies are too difficult to manage at home. If you are reaching the point where medications don't work, or you're taking too many of them, where side effects occur, or where associated conditions like sinusitis and asthma occur, it's time to consult your doctor or allergist. A complete evaluation with testing will be important for your health.
Hello, I'm Vivian.
Hello.
I have a 1 o'clock appointment with the doctor. I'm having trouble with my allergies. Will he be long?
No, he'll see you in just a few minutes.
Terrific.
Hi, I'm Dr. Arnold Kirschenbaum, board-certified allergist-immunologist. What brought this patient here? She has obvious problems, but is she allergic? Does she have sinusitis, an infection of her sinuses? And what about asthma? And did you know that all three conditions, allergies, sinusitis, and asthma, are related? We call this the Allergic Triangle, and we'll discuss these in detail later.
I want you to blow into the canister as hard and as fast as you can and then inhale back. And we'll take the best of 3 tests.
Okay.
Your tests are a little low. I'm going to have you breathe 2 puffs of this asthma medication, albuterol. You should feel a lot better, and I'll show you the correct way. Hold the canister 3 to 4 inches away from your mouth. Start taking a slow breath and inhale a puff. Hold your breath for 10 seconds, and then breathe in again and take another puff. I'll repeat the test in 10 minutes, okay?
Okay.
Your tests are a lot better. How do you feel?
I actually feel better.
Good. I'll let the doctor know you're ready.
This young woman didn't know she had asthma, but if her baseline pulmonary function testing improves by 15 to 20% with an asthmatic drug such as albuterol, the diagnosis of asthma is made. This is important because cases of asthma are increasing, asthma can be life-threatening, and correct medications are needed. One should not use, for example, cough suppressants to treat asthma. Corticosteroids are the cornerstone of treatment for asthma. Corticosteroids reduce and eliminate inflammation and will not build muscle like anabolic steroids that some athletes use. The airways in the normal lung are open for air currents and gas exchange. In asthmatics, the airways are inflamed with swelling, mucus production, and poor air movement. The lungs overinflate because air is trapped inside. Patients feel short of breath and uncomfortable.
I'm 42. I've been having the same problems for many years now. Itchy, watery eyes, stuffy nose, a sore throat, and a cough.
Can you sleep?
Not very well. I wake up during the night with congestion in my nose and chest and have shortness of breath in the morning.
Have you been using any medications for these symptoms before?
It doesn't work for me.
This young woman's history, her complaints or symptoms, are classic for allergies. When physicians or healthcare providers examine a patient, they look for signs or diagnostic clues. Listen to the provider tell his patient some signs.
I'm concerned about the red, swollen eyes, dark circles, and swollen nasal membranes you have. They're probably due to allergies. But your pulmonary function testing, which was low, improved 20% and is diagnostic of asthma. And I hear some wheezing or whistling in your chest when you exhale. I recommend you have skin testing to find out which allergies you really have.
So this young woman has allergies and asthma. Are they related? Very much so. Allergies are the most common trigger for asthma besides viral infections in children and adults, and studies now show that allergies left untreated may actually cause asthma to develop. Grass pollen allergic asthmatics have 200 times more chance of fatalities during the peak season. Therefore, child and adult asthmatics should have testing to learn if they are allergic. Crick or surface testing and intradermal or under-the-skin testing are very sensitive and specific. They give immediate results and are inexpensive. Blood tests, known as RAS tests, are more expensive and measure the amount of allergic antibody, IgE, being made. Problems may arise if a patient makes smaller amounts of IgE that it cannot be measured, because the RAS test will be negative when in fact the patient is truly allergic. RAS tests, therefore, should be reserved for those patients who cannot be skin tested.
Wow, that itches.
No question. You have allergies, dust mite, and grasses. I'll let the doctor know, and he'll be with you in a minute to discuss your CAT scan.
Okay.
The diagnosis of sinusitis can at times be difficult to make, but like allergies, it depends on history, physical examination, and computerized x-rays. Listen again to the young woman's symptoms.
Oh, yes, I have headaches daily. I'm so tired. I have a sore throat and a bad taste all the time.
Did you have a cold or a virus any time in the last 6 months?
Yes, I had the flu about 2 months ago. I was very, very sick.
Sinusitis can either be acute or chronic. With most cases of acute sinusitis, symptoms last less than 4 weeks, are caused by bacteria, and include facial pain or pressure, nasal congestion, runny nose, postnasal drainage, decreased sense of smell, headache, bad or metallic taste, fatigue, teeth pain, and cough. With chronic sinusitis, symptoms last 4 weeks or more, are caused by inflammation and swollen sinus tissue, and may be similar to those of acute sinusitis, although the only symptoms might be congestion and cough. On examination, dark circles appear under the eyes. Nasal membranes are pale and swollen and are associated with congestion, drainage, and sinus pressure. A patient may be tender when touched over the sinuses. Remember that any viral cold lasting longer than 7 to 10 days is not a virus and should be evaluated for sinusitis. And in over 50% of patients with sinusitis, allergies are present.
Let me orient you. This is a normal CAT scan, and this is yours. White is bone. Gray is tissue. Here are your eyes, here's your nose. Black are the sinuses. The frontal sinuses right behind your forehead are here. The ethmoid sinuses, they're right between your eyes, they're here. And the maxillary sinuses, they're left and right from your cheekbones. The gray areas that you have on your CT scan here are abnormal and shouldn't be there. This is chronic sinusitis. This has been there for many months. However, you most likely have acute sinusitis and bacteria in the same area causing many of your symptoms. We'll discuss treatment when we go back into the exam room.
The patient indeed has sinusitis, inflammation and infection of the sinus cavities deep within the skull. Remember that sinusitis can occur when nasal membranes that are swollen from allergies or viral infections block drainage and allow sinus pressure and bacteria to increase and spread. Allergies and viral infections account for over 75% of cases of sinusitis. Antibiotics alone for sinusitis never work because the sinuses must drain. In addition to antibiotics, treatment may include saline nasal drops, nasal and oral decongestants, and nasal steroids. We know about the relationship between allergies and asthma, and allergies and sinusitis. What about the relationship between sinusitis and asthma? In some studies, Over 75% of asthma cases are associated with sinusitis. Once the sinusitis is fully treated, the asthma improves. Conversely, sinusitis which is not fully treated may allow asthma to continue or worsen. Ironically, more medications may be prescribed for asthma when in fact it is the sinusitis that needs treatment. We now have all three parts of the triangle. Allergies can cause sinusitis and trigger asthma, and sinusitis in turn can also cause asthma. Your allergist specializes in treating allergies, sinusitis, and asthma, and can assist you and your doctor with treating these conditions. But what is the best approach?
We need to treat your allergies and sinusitis thoroughly and aggressively. Your asthma should improve once the allergies are under control. It might take 4 to 8 weeks to fully cure the sinusitis and further improve your asthma.
Allergies, sinusitis, and asthma are all treated separately. However, medicines may overlap. Allergies are treated with either nasal steroid sprays, antihistamines alone, or antihistamines in combination with decongestants. Sinusitis requires treatment with antibiotics, nasal decongestant sprays, followed by nasal steroids and an oral decongestant. An antihistamine combined with a decongestant is oftentimes used to further control allergy symptoms. And asthma is usually treated with bronchodilators alone if mild, or in combination with inhaled steroids to control inflammation. The new leukotriene modifiers are also available now to treat inflammation.
Do I need allergy shots?
All patients ask us about allergy shots or immunotherapy. Our goals for you, as of for all of our patients, are 95% improvement, whatever that is for you. Immunotherapy, if needed, and no medications, if possible. Are shots therefore necessary for you? The medicines discussed are excellent and will work well, but they are temporary. The best long-term treatment would be allergy shots because the shots work like a vaccine, reducing your sensitivity and controlling your allergic condition. Shots are as close to a cure as possible. Many clinical studies have proven that they work to control allergies and reduce complications such as sinusitis and asthma.
Each patient is unique and requires special care. Always discuss your condition with your provider and know when to seek help. For all patients, the goals are the same. 95% improvement, immunotherapy, allergy shots if needed, and no medications. In this way, we can all live happier and healthier lives.